the family engagement today, as we have a presentation by our very own Superintendent, Alicea, regarding the opening of school for the 2021 to 2022 school year. Please note that you all have been muted and will remain muted for the duration of the presentation. If you have questions, we will ask that you put them in the chat. Please be advised that we prefer you to wait until the conclusion of the presentation, because quite often the questions that you ask as you write them in the chat are answered on the next slide or before the presentation has concluded. So without further ado, this is also being live streamed on Facebook. So if you have not gotten that notification, that's to make you aware that it is also on Facebook and will be posted to the district website at the conclusion of the presentation. Okay, once again, thank you for joining us, and I will now turn us over to Superintendent Alicea.
Thank you, Chief Williams, and thank you to all the staff from the Family Engagement Office for working together to share this presentation with the staff. To the staff, thank you for joining me this afternoon. And before we get into the presentation, I want to say thank you. Thank you for all the work that you have done to support our students, our families in the Syracuse City School District. Last year was an unprecedented year, like we have heard since March 2020. And you did a great job working with our kids, working with our families, supporting each other, and making sure that our kids were getting quality education in the district. As we continue to go through the year, we were planning for the reopening for the 21-22 school year. We were reading articles, we were following guidance from different organizations. And today I'm here to share with you some of the work that we have done to continue to provide quality education to all the students in the Syracuse City School District, taking into consideration the health and safety of all the students and all the staff in the Syracuse City School District. That is a priority for me, it's a priority for the board. We want to make sure that we're doing everything that we can to support you and support our students in the district. As I said before, we were working during the school year, reading all the guidance that was coming to the school districts. We received last April guidance from the United States Department of Education on COVID-19, a handbook. It was a roadmap to reopening safely and meeting all student needs. If you recall, that guidance came out last April, and that was part of the document that we used when we brought more students back in April, when we increased the number of kids that were coming to school in person. We also received guidance from the Center for Disease Control and Prevention. This guidance for COVID-19 prevention in K-12 schools is the guidance that was recommended by the New York State Health Department for us to follow. We received guidance from the American Academy of Pediatrics on COVID-19. Again, this is guidance to reopen the schools, making sure that they were safe. Because we were not getting guidance on time from the New York State Health Department, the New York State Education Department put some guidance regarding the health and safety for the 21-22 school year. Also last Friday, we received guidance from Onondaga County Health Department, the guidance for K-12 school reopening, getting kids safely back to in-person learning for the 21-22 school year. And also last week, we received from the Upstate Medical University back to school masking statement from doctors from Upstate Medical Center. Based on all that guidance that we received, based on what we were hearing from New York State, so we have a goal. And that goal is to provide all students pre-K-12 in-person instruction 5 days a week during the 21-22 school year. We will continue to provide remote instruction to students who have documented immunocompromised system or that they have some mental health illness. We want to make sure that we're taking care of all our kids, whether they're in person or whether they're going to be remote. We look at the data from attendance data from last year, and we know that the students that were in person, attending school in person, had higher attendance than the students that were remote. So how are we going to do this about getting kids back 5 days a week, getting the staff back? We know that according to the CDC, vaccination is the leading public prevention strategy to end COVID-19. We want to make sure that we continue to encourage all the staff in the district to get vaccinated. Staff will have the opportunity to provide documentation of vaccination or to submit to weekly testing for COVID-19. This morning, the county executive issued a local emergency order number 22, asking for all staff in the school, whether teachers, TAs, bus drivers, bus monitors, food service personnel, to provide documentation of vaccination or to submit for weekly testing for COVID-19. We are working with the county health department on how we're going to do the testing in our school. We want to make sure that we do this on site, so we make this easier for you, for the staff, so you can be tested in your work site. We will continue to encourage our families to have the children ages 12 and up to get vaccinated. Last year, we had 8 clinics in our middle and high schools. This year, this past summer, we have 4 clinics in collaboration with Wegmans, and we will continue to partner with Wegmans Pharmacy, Kinney Drugs, and the county to continue to do vaccination clinics in our school. There's a second dose clinics that are coming up next week. PSLA at Fowler will be Wednesday, August 25th from 9 to 12 p.m. Fraser, also Wednesday from 2 to 5 p.m. ITC on Friday from 9 to 12 p.m. And Lincoln Middle School, also Friday the 27th from 2 to 5 p.m. Again, this is a second dose clinics, but if the parents want to bring their kids in for the first one, they're welcome to do that. If any staff member wants to participate and have their vaccination at one of the clinics, they're also welcome to do that. And the second one could be done later on during the school year or going through one of the Wegmans pharmacies. We will continue to work with Onondaga County Health Department to do surveillance testing in the school like we did last year. We will be giving our families a consent form the first day of school so they can sign up for their kids to be tested throughout the year. This testing will include not only students, but also staff members. We want to make sure that if people are not vaccinated, that they're tested weekly so we can keep our schools open. One thing that will be mandatory for next school year will be masking. The Center for Disease Control, the American Academy for Pediatrics, Onondaga County Health Department, the guidance from the state, and the guidance that we received from the Central New York Pediatric Group recommend indoor masking, including teachers, staff, students, and visitors, regardless of their vaccination status. We're going to ask everyone coming to our school to wear a mask. Masks will also be required on buses. Masks will be optional outside during recess time. We will provide mask breaks during the day, and masks will be available for students and staff. When we say mask, when I say mask, we're talking about the regular mask. We're not talking about bandanas. We're not talking about the goggles. We're talking about the regular mask, the blue or the fabric mask that we used last year. We will follow the guidance from the CDC to maintain 3 feet of social distance in the classroom. We also have the polycarbonate dividers available, and we strongly encourage the use in the classrooms and also in the cafeteria. We will continue to monitor the transmission rate in the county and the city, and will adjust based on the recommendations from Onondaga County. It is important that we continue the mitigation measures that were put in place last year. We'll continue to do temperature screenings daily for students, staff, and visitors. We ask the staff to do the screening at home if you have a thermometer at home. Even though the temperature checking is not required anymore, we will continue to do that. We bought 250 new thermometers that will be installed in our buildings, that they can read the temperature on your forehead, your arm, or your wrist. So we don't need to have someone standing in front of you to take the temperature. We will continue to reinforce the proper use of masks, making sure that people are covering their mouth and their nose, not like some people have done in the past, only their mouth, of their chin. We will be doing videos for our students in September so they can see the proper use of masks. We continue to encourage the proper hand washing. As we said last year, and we had the video, it takes about 20 seconds for kids, for adults to wash their hands properly. And we will continue to reinforce the physical distance. There will be the signage on the floor about keeping physical distance in the hallways, in the cafeteria, and also in the classrooms. For ventilation, last year we installed 2 portable air purifiers in every classroom. This year we acquired 1,000 more of those small air purifiers units, and they will be placed in all instructional areas in the building, whether it's a small office for the psychologists, the social workers, all those areas, we will be putting air purifiers unit. We purchased 250 larger air purifiers unit, like the one that in the picture there, and those are for the cafeterias, libraries, and large group instructional areas. Again, there's research from the Mayo Clinic that shows that these air purifiers do work and that they help reduce the virus. So we want to make sure that we are taking that into consideration, and we're placing those air filtration units in every classroom and large instructional areas. We have updated the HVAC control system. We have new software, so we can continue to run the HVAC system like occupied 24/7 to get more fresh air into the buildings. Those systems will be running 24 hours, 7 days a week. We have upgraded to the higher MERV filter levels that we can use with the system that we have in the schools. And we also have replaced carpet in more than 200 classrooms. So that way it will be easier to clean and sanitize our classrooms this coming year. We're asking staff, we're asking parents that if they're sick, to please stay home and get tested. If you're showing any of the symptoms from COVID-19, like fever or chills, cough, shortness of breath and difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste, of smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea, if you are showing any of those symptoms, please stay home and be tested. We know that sometimes sore throat is not a symptom of COVID-19, that the congestion or runny nose is not also a symptom of COVID-19, could be the flu, could be allergies, but we're asking for our parents, guardians, and the staff, if you have any of these symptoms, to please stay home and be tested. We are working on having extracurricular activities this coming year. We're working with the county to continue to do the screening that we did for sports last spring. We want to make sure that our kids are able to participate in sports this coming year, that we continue the drama productions and the club activities that they missed last year. Again, we continue to work with the county to monitor the infection rate in Onondaga County in our community, and we will follow the guidance from the Onondaga County Health Department. If any staff member, or we're going to ask also the parents of our students, if any students or any family member is positive for COVID-19, to please notify the principal, the school nurse, her services, or your immediate supervisor, so contact tracing can be conducted. We want to make sure that we're following the guidance from the state, from the CDC, from the county. So it is important that if any person is positive, to let us know so we can begin the contact tracing and follow the guidance from the Onondaga County Health Department. We'll continue to work with the county to monitor what is happening in our community. We will continue to track the community transmission, the vaccination coverage in the county, the testing in the community, the schools, and the outbreaks, and we will follow the guidance provided by the Onondaga County Health Department. If we have to close the school, if we have to go remote, we will work with the county to monitor the transmission rate in our community. As we did last year, we had some guides available for families and for the staff regarding COVID safety. We are finalizing those two guides because we're waiting for more guidance. I received information that the New York State Health Department will provide guidance for us, hopefully by the end of the week. So we want to make sure that that information is included in that guide that will be available for families and staff. So I want to say thank you for joining us. I know that there's some questions. Again, we don't have all the answers yet, and I want to be transparent with you because we're still waiting for more guidance that will be coming from the state. But we want to make sure that everything that we do is to ensure the health and safety of our student, staff, and families. Thank you.
Thank you, Superintendent Alicea. Team, if you would now move forward with asking the questions that are present in the chat.
Will we be required to submit the daily attestation again this year?
No, the daily attestation, it is not required by the CDC or by the academy. So at this time, we're not requiring the attestations.
How will schools maintain social distancing in classrooms with rostering being so big? We typically have between 25 and 30 students in a room. What is the plan for this?
Again, we're following the guidance from the CDC and we're following the guidance from the American Pediatrics. It is said there that when you can keep the 3 feet that they're recommended, that's why masks are mandatory to be used in indoor facilities, the classroom, the cafeteria, and those areas. We also have those polycarbonate partitions that we ordered last year. So they are available for use. But again, the most important tool are the masks for us to use in the buildings, in the classrooms.
Will teachers be responsible for?
Facebook Live, sorry, Selena. There was some research suggesting that barriers are helpful. Will they still be used?
Yes, they're going to be available in the buildings to be used.
Will teachers be responsible for cleaning desk shields?
No, teachers are not going to be responsible for cleaning the shields. We do have the magnetic guns that we ordered last year, and we will continue to use that. We will have also the wipes in the classroom, things that the kids also can use, but no, the teachers are not required to do those, to clean those. Bless you. Whoever it is.
It's Chief Wright Williams, bless you. What are the policies on students working in groups and students sharing materials in the classroom?
Again, we will put all that together in the guidance. We know that kids can be in the room. We need to keep the social distance with the class within the classroom. So I do not encourage to have kids working in groups, but I will get more guidance on that and will share that with you.
How do we enforce masks with special ed students?
It is the same thing that we did last year. We need to continue to work with them, show them the proper use of the mask. And this is not anything new. We did it last year. So we will work with the family. We will encourage them to continue to use the mask in schools and also on the buses.
Are masks required when the dividers are used this year?
Masks are required all the times in the classroom. Again, we will give the student the mask breaks, but masks are required for indoor use.
How will teachers and students who are tested positive handle staying home? How will instruction be delivered to those required to stay home?
We will be working on that. We will be doing remote instruction for some families some of the students that have issues. We are having another meeting with the county Thursday regarding quarantine, and we will share that information with you. If the students are vaccinated, if the teachers are vaccinated, quarantines are not going to be necessary. So that information will be shared with you by the end of the week.
Will lead teachers be responsible for teaching the virtual students while working with the in-person students as well? Or will there be a different teacher?
It will be different teachers. We are working on for the secondary level using Canvas for instruction. So it will be a different teacher.
For high school students and middle schools, will students be moving from class to class, or will teachers be moving? If students are moving.
Can't hear
Sorry,
you.
I'm not coming across. Instead of the school doing the weekly testing, can we take our children to the doctor?
I believe, yes, you can. You just have to provide documentation.
For high school and middle school schools, will students be moving from class to class, or will teachers be moving? If students are moving, how do we enforce social distancing and masks in the hallways?
We are still working on that area. We were hoping that we were going to have a regular year, but we are still finalizing that, and we will let you know. Some schools last year, they had the kids move, and we didn't have any large increase in the numbers, but we will let you know. Principals are working on that.
Will lead teachers be responsible for teaching the virtual students while working in person?
We already had that one.
Oh, sorry.
No, that's okay.
If a parent is not comfortable sending their child due to the high number of COVID cases, will they offer virtual instruction?
And virtual instruction, that this is something that is all the school districts in Onondaga County will be given priority with the student with health issues. That's the plan. Documented health issues.
Will staff have to use sick time for quarantines?
If the staff have been vaccinated, the county is saying that, the health department, that we don't have to put the staff on quarantine. So if you have used the days in the past, you will probably have to use sick days. So we are waiting for more guidance from the state regarding that.
Are there going to be air purifiers available for offices?
As I said, sorry, I just got a message to stop sharing the screen. Yes, there will be, like I said at the beginning, we ordered 1,000 more units to be available for smaller instructional areas and offices.
Will staff have to present their documentation for vaccination to their building leader?
Yes, we are working on that. That's the best way to document that information. Also, our IT department is trying to come up with an electronic way to do it. So that way you can submit the information electronically and it will be sent to HR and we will keep that information down here. But the goal is to do it at the building level. So that way the principals will know, or whether it's the director of transportation or whether it's in food service, that they know who are the people who are vaccinated or who are the people that will need to get the testing every week.
What are staff choices if their own children have to be quarantined?
I don't have an explanation for that, an answer for that yet. Being transparent.
Are you going to have testing at every school?
We are working with the county to do testing in all the schools. So we will be getting the schedule ready and we hope to begin the first day of school on September 1st.
Will staff need to keep creating lessons for both in-person and digital students?
Hopefully not. Hopefully we are going to be using the lessons that we did before with WCNY, the lessons that are already on Seesaw. So we will continue to use those lessons.
What will be done if students refuse to wear their mask properly?
Again, the same thing that we did this past year. We need to work with the students, and if they're refusing to do that, then we'll need to talk to the administrators.
If a family member is immune compromised, can their student be remote?
They can file an application. Our medical director will do an evaluation and we'll decide whether that is a valid reason for remote instruction.
How often will unvaccinated staff be tested? Will we bring in our cards to prove vaccination?
Once, if you're not vaccinated, you will go for testing. If you get the vaccination, 2 weeks after your second dose, you do not have to be tested any longer.
What's the best way to remind staff members to wear the mask properly over the nose/mouth?
Sorry, I'm smiling. We need to work in this together, and people should not take things personal when they're told, that is not the right way to wear the mask. I will continue to do in my emails on Friday to let the staff know to please wear the mask correctly. But also, if we continue with the phone calls, also do it there. But I will ask for the principals, the administrators at the building level, in their announcement to remind people of the proper use of masks.
Are unvaccinated students will need to be tested weekly?
No. If they're vaccinated, no.
What about those that are not, the kids that are 12 and under?
We are working with the county on how we're going to do the test for all the elementary school, whether it's going to be sample testing or whether it's going to be all the kids. So again, as I said at the beginning, we have a meeting on Thursday to talk about testing in the schools by Onondaga County.
Superintendent, if a parent has a student with a documented medical concern requiring remote instruction, where do they submit that and what does that process look like?
The applications are posted on our website. They can submit that electronically. It will get to our IT department and also to the health services department, and our medical director will review those applications.
What is the protocol for students that are exhibiting any upper respiratory symptoms while in school?
Again, it will be taking the kids or sending the kid to the nurse's office. We will continue to have the isolations room in operations in all the buildings. We hired 10 more health aides, so we can have a staff member in those in the buildings to make sure that if a kid is showing some symptoms, that we can isolate them and get in contact with the guardians.
If a staff member tests positive for COVID, do they have to use their sick days?
Yes.
Staff members have been fully vaccinated since February. Do we know if and when a booster will be required?
If you're following what is happening at the federal level, they have approved a booster for people with immune compromised system. I believe that today another announcement will be made recommending a booster after the 8th month. So probably it's going to be in the same order that it was done in January for the vaccine. Priority will be given to people in the medical field, nursing homes, and all that. And I hope that also educators will be included in that group.
I heard you say high school will have a different teacher. Will there be a different group of teachers to teach primary students?
We are working on getting teachers that are going to be fully remote, working with the kids at all levels. Yes.
Superintendent, there's a question I think you've answered, but they keep writing it and I'm not sure why. It says not asking the question as is being written. If you are vaccinated and still get COVID, will you be required to use your own sick days? But I think you've addressed this.
And the answer is yes.
Considering the need for contact tracing, will buildings be open to families this year?
Buildings at the beginning will continue to monitor. If the infection rate continues to go up, we will make some adjustment. But again, parents will have to, and guardians will have to come in with masks. No mask, no entrance.
And for that last question, you said, yes, they will have to use their sick days. We're clarifying that means teachers, correct?
Correct.
Thank you.
But again, let me be clear. We are working with the county with the guidance about quarantine and all that. So if there's any changes, I will make sure that that information gets to you quickly. Yes, I mean, those were from the federal government and those days have gone away.
How will seating on school buses work?
The latest guidance from the CDC and also from the county is that we don't need to keep social distancing on the buses as long as they are all wearing masks. It's the same thing as transportation, public transportation. for the buses or the trains in New York. As long as people are wearing masks, we don't need to keep the social distance.
Can vaccinated employees opt to get tested in their schools?
Yes.
Staff members who have been fully vaccinated since February, do we know when and if we will need a booster?
We don't know yet. Like I said before, the booster was approved for people with immunocompromised system, but I believe that today another announcement will be made for people who have had the vaccine more than 8 months ago, that they will qualify for a booster. There's going to be a cycle or an order for that, people working in the medical field, and that I hope that teachers and school employees will be given priority also.
If we know there are breakthrough cases with those vaccinated, will there be testing for vaccinated students / staff to prevent further breakthrough cases?
We are working with the county on that. So we hope that, you know, if you were vaccinated, you have some symptoms, you don't know, that we can do testing in the school.
What percentage of students and staff will the building need to close?
That I don't have a number yet. Again, the guidance from the county is that if people are vaccinated, if the students are vaccinated, that we don't need to put everyone on quarantine and that we can continue to keep the schools open. But it's important is that people take advantage, and if they're not vaccinated, get the vaccine, wear the mask. That's the main reason why we're making sure that masks are necessary in our school. Is one of the best after the vaccine. It's one of the best tools to fight COVID-19.
What if staff are refusing to get vaccinated? It didn't feel safe being in meetings with them.
As long as the person is being tested, the person should be okay.
When will the when the boosters are available to staff, will they be required to provide proof of that booster?
We are waiting for guidance on that area.
Just to be clear, class sizes can be back to normal as long as divider and mask are worn?
Yes.
Thank you.
What will teacher evaluations look like this year if student collaboration is limited?
We will get back to you with an answer for that. I believe this year teachers were evaluated remotely, so we will get back to you.
Will high school students be potted again with limited transition?
The high school principals are working on the schedule, and we'll be going back to a 7-period day. So hopefully they're going to be giving priority to that. It is going to be more difficult, but the high school principals will be sharing that with you.
Can students share materials such as calculators and other supplies?
We are working to make sure that we have individual supplies for all the students. So hopefully we'll have all those available for you. Again, you know the kids, you know what is happening in the classroom. So we will provide those wipes for cleaning and everything. So I will recommend to try to avoid sharing materials, toys, and supplies.
Is there any way to have some testing kits in the nurses' offices so that anyone exhibiting symptoms can be tested and get their results at that time? This would greatly speed up the process of contact tracing and containment of the positive person.
And we are exploring that option of having testing available at the buildings. I know that some of our nurses are very willing to work and support us in that area. So we are communicating with our nurses regarding that. We are also communicating with the county. The county is moving away from the rapid result test, the biometrics, and using the new PCR that is saliva-based, and it takes a little longer, but we're looking at trying to get the result as soon as possible. But that's a great suggestion. Thank you.
Superintendent, so if a staff is vaccinated and test positive, can they still transmit, and are they going to be quarantined or no?
If the staff is vaccinated, they can still get COVID and they can still transmit the virus. So if they're positive, then I believe the county will put them on quarantine.
The chat looks clear.
Let's see. Please address meals. Specifically, what are you doing to mitigate disease spread during lunch in high schools? Cafeterias are normally so crowded.
Our principals are working on the schedule. We are recommending to have some classes in the cafeteria, some classes can eat in the classroom, and then flip. We are also putting those partitions in the cafeteria for lunch and keeping social distance in the cafeteria. While they're walking to get the lunches, keeping the 3 feet and making sure that, you know, they're using those partitions.
Another question came in the chat. What about the employees' privacy if they are not vaccinated?
That information will go to HR and health services. It will not be shared with anybody else.
Do you have any insight as to when children under 12 will be allowed to get vaccinated?
And that's one of the questions that we have asked a lot to the county and the health department. There were some conversations that probably by the end of September, the vaccine will probably be available for children ages 11 or younger. But again, that is information that was shared with me. I cannot tell you that that is going to happen.
There's a question in the chat. You said that the administrators would know if the employee is not vaccinated.
Well, yeah, because I mean, if the person is not vaccinated and has to be tested, we got to monitor that. So again, we are working with the union on that. We're working on the MOU, but that's why we're asking, you know, for people to share with their supervisor.
Can employees bring their own children to the vaccination clinics?
If they're city residents, I believe they can. I will check with Wegmans, and when we do the robocall, I will let people know.
Thank you.
Is the district helping teachers with affording supplies for students, or are parents allowed to send supplies?
Parents are allowed to send supplies to be used in the classroom by that student only. But again, we are ordering a lot of supplies so we can have them in every classroom.
The administrator has to respect privacy. That yes, I think this is referring to
Yes,
the
yes,
vaccine.
yes, yes.
Will every student get a computer again this year? Such a great smile you have.
You know why I'm smiling? Because we're working in getting computers back. We handed out 14,000 computers last year. And as of August, when we finished our summer program, we still had more than 6,000 computers out that the students did not return, parents did not return. So we're still working on getting all those computers back. But it is important that, you know, if we have to go remote as the entire district, that every student gets a device and that they use it. That's why all that information is in school tool. We know who returned the computer, who did not. The hotspot that were provided to the families, they were deactivated this past August after summer school. We do have more hotspot that will be available for families in September if needed, but we need to continue to try very hard to get all those computers back so we can upgrade the system and do everything that we need to do for to have them ready for September.
Will related studies be teaching in front of students this year?
Yes.
What will happen if a CTE student is approved for virtual? Most CTE courses have specialized teachers.
That's one of the things that we're working on. CTE programs should be in person. A kid that is learning how to cut hair, you can't do that remotely. You can't do that with a computer. I will not go to a barber who learned to cut hair in a computer. So we are working with our families, working with our teachers to make sure that CTE is in person.
Do we know what technology will be available in the classrooms?
We are working on that. We were putting technology back in the classrooms, but because of the large amount of computers that we did not get back, we're waiting to see what happens for the opening of the school year. If we have to go remote as a district, we gotta make sure that those computers are out in the hands of our staff and in the hands also of our students. So we're working on that. We have cards available in the buildings, but we do not have all the technology that we had before until we know what is going to happen with the pandemic.
Are students going to be allowed to use lockers this year?
Yes.
Is singing allowed this year? And if so, what are the requirements for that? And will we have concerts?
We would love to have concerts. There's guidance about music performances, singing and all that, keeping the social distancing. So yes, it's in the guidance from the county. We'll make sure that you get that in September.
So as far as quarantining, if a student is in a class and is positive, does the whole class have to quarantine?
No.
Or just the student who sits next to them if they're unvaccinated?
It's the kids who are sitting next to it, not the entire class.
Okay.
I hope this doesn't happen, but do you predict that we will be going remote?
I hope not.
What will happen if Henniger is not ready to open due to renovations?
We're working very hard to bring the building back so we can have school in there. We're meeting every week. We're looking at the progress. We know that the new wing will be ready. There are 4 classrooms on the first floor where the new library is going to be that we are working on. There's some also classrooms down in the basement, but we feel that, you know, at least they're going to be classroom for us to be in person. I can't guarantee it. I'm there every week checking the buildings, but we do have some extra space. I know that the main area for where the office is going to be, what it used to be called the new wing, that is not new anymore, is not going to be ready for the opening of the school year. The way they have done a lot of great work in some of the areas in the building, locker rooms and all that. So, and the new wing it's looking pretty good.
And no more questions in the chat.
Again, if there are no more questions, I want to say again, thank you for joining me this afternoon. Thank you for your support. We have done a lot of work in this area. You have done an excellent job last year working with our kids, and we continue to take care of each other and support each other because our kids deserve the best, and that's you. So thank you for all the work that you have done and that you will continue to do to support our kids, our families, and to support each other.
Thank you, Superintendent Alicea. I was answering questions from the Facebook chat. There are a few more questions on Facebook. However, there's nothing that we either haven't touched upon or that we can't respond to via Facebook at the conclusion of this session. So at this point, I would like to just thank everyone for joining us. Thank you so much.
Thank you.
I'm so sorry, multitasking on Facebook is tough. Superintendent, anything else you want to say before you depart, or has he departed?
I think he's gone.
He's departed. Okay. Yeah, I got cut off. My apologies, everyone. I was trying to manage Facebook and Zoom. So everyone who's still in the chat, thank you so much for joining us. We look forward to seeing you in future CoVideo chats. Have a fantastic rest of your week. Bye-bye.